Hello, everybody. Thank you again for being here for our community update on Thursday. Again, if you have questions, you can send and submit questions to COVID-19 at saukcountywi.gov. That would be COVID-19 at saukcountywi.gov. I just want to thank everybody for the last 4 months as I've been leading these community calls. I appreciate the folks and the information and the questions that we have been given and the feedback. It's been great. I will be transitioning out of this role as incident commander, and I would like you to introduce you to our new health officer, Timeliness Stewart, who will be taking over the charge.
Hello, everyone. My name is Timeliness Stewart, and I am the new health officer for Sauk County. It's a pleasure to be here and to work with all of the awesome, great people here at the Sauk County Health Department, as well as serve the community of Sauk County. I do hail from New Jersey, where I worked in health for the last 7 or 8 years, and I'm just really happy that I'm taking on this role in the midst of the pandemic, but and I'm here to serve the community of Sauk County. Thank you. And now I'll pass it off to Jesse, who will have further announcements.
Hey everybody, just wanted to do a couple updates here with regards to disease investigation and contact tracing. With the decrease of cases lately, we are now able to contact more cases. And in addition, we're able to get in touch with close contacts of our cases as well. Many of those will be sent off to the state contact tracing team. So just be aware that your call, if you are a contact, might be from somebody from the Department of Health Services. So we're asking that you please answer those calls, whether you're a contact or you've tested and you're awaiting results. We are asking that you please, answer that call so we can gather the data from you and help get your close contacts quarantined and give you the proper instructions that you need to keep yourself safe. Timely disease investigation and contact tracing really does help slow the spread of COVID-19. And then while we are waiting to get everybody vaccinated, we want to just remind everybody of all the tools we have in our toolkit to slow the spread of COVID-19 until we can get widespread vaccinations out. Testing is one of these tools. It can lead to quick identification of cases and treatment for those who are sick and isolation to prevent further spread of COVID. But for it to work, we need your help. We are continuing to see testing numbers in Sauk County decrease. So I'm going to turn it over to Jody, and she's going to give us a little bit of an update on some of our testing sites.
Sure, thank you very much, Jesse. So as you'll see on your screen, we do have testing available most days of the week throughout Sauk County. I will caution you for this coming week, due to the extremely cold weather, we may have to make some changes because the places that take their fire trucks outside to run the testing can't leave their fire trucks out in that sub-zero weather. So we will kind of keep things fluid as we wait and see what the weather actually turns out to for next week. Just a reminder, we are able to test anyone that is 1 year and older at our free community test sites. We do recommend testing for everyone with any COVID symptoms, anyone who has had close contact with someone who tested positive for COVID, people who have regular exposure to many people, such as if you work in a grocery store, maybe if you're a waitress, that type of thing. And if you are getting tested because you're concerned that you would have been exposed, we ask that you wait for that 6 to 7 day window after your possible exposure to get tested unless you are experiencing symptoms. And as a reminder, we do not recommend testing if you plan to attend a gathering, because that test only will tell you the snapshot in time of the day you are tested. And we also don't recommend testing for people who want to get tested just regularly for peace of mind. We do want to save our testing resources for symptomatic people, those who have been a close contact, and those who are regularly exposed to people. So please, if you would like to get tested, go to our website and you can find all the free testing sites that we have throughout the county, and it'll explain to you how to register for each of those. And I will give it back to Jesse now for a vaccine update.
Thanks, Jody. So just as a little update, the Wisconsin COVID-19 vaccination program is following the Advisory Committee on Immunization Practices, otherwise known as ACIP, and the Wisconsin State Medical Advisory Committee, SDMAC, guidance about how to prioritize groups for COVID-19 vaccinations until there's enough vaccine for everybody who wants one. Sauk County Public Health is following these prioritization recommendations. And we do understand that it is frustrating when others are not following this guidance, but we do not have any control over what others do. Just know that we are following the guidelines that are set out for us. So just as a reminder, who is currently eligible for COVID-19 is frontline healthcare personnel, residents and staff of long-term care facilities, fire, police, and correctional staff, and those who are age 65 and older. And next eligible, as you can see in the right-hand column, will be education and childcare, individuals enrolled in certain Medicaid long-term care programs, some public-facing essential workers, non-frontline healthcare essential personnel, and facility staff and residents in congregate living. And those will be determined sometime on or after March 1st, and we do not know yet the order in which those will be rolled out. So if you are currently eligible to be vaccinated, you can go to our website, and we have our nice little COVID-19 vaccination site locator map, much like our testing site locator. You can click on one of the green circles in your area to find out more information about sites that might be able to vaccinate you, and the details will be there for you to let you know how to sign up, if there's a waiting list, or what you need to do. And then just a few other highlights. Just be aware that all of the vaccinators who are eligible to vaccinate in Sauk County have all received reduced allocations of vaccine this past week. And we anticipate that may be the same in the next week or two as well. We will keep you posted on that. And we are asking that you please only put yourself on one waiting list. You know, if you're going to sign up, please don't sign up in multiple places. It just helps, you know, people know what the needs are, and it makes things run a little bit smoother. We ask for your honesty when signing up as far as where you live, and that you are truly eligible to receive the vaccine at this time. And then lastly, please remain patient with all of us. We are doing the very best we can to get people vaccinated in the appropriate amount of time and when it's your turn. Then again, just reminders about how you can be kept up to date about vaccine rollout. Signing up for NIXLE by texting your zip code to 888-777. And we also have our webpage, which is on the screen for you there, and then our social media pages, including Facebook and Instagram. We are doing our best to keep those up to date as changes come our way.
All right, and the first question that we received for this week is, how many doses of vaccine have been allocated to Sauk County, and what percentage of that has been administered?
Great question. Sauk County Public Health is doing our best to work with all Sauk County vaccinators to ensure that the doses are administered as quickly as possible so those doses do not expire. We meet multiple times a week with the other vaccinators in the county to collaborate with these efforts. Thank you for your patience as we work together on this process. At this time, we are not able to provide a number of doses received and a percent of doses administered specific to Sauk County, as the doses are allocated to vaccinators in Sauk County might be administered to individuals from other counties, and Sauk County residents may be vaccinated in other counties as well. For example, a Sauk County healthcare provider might have patients from surrounding counties. A healthcare worker who works in Sauk County but lives in another county may have been vaccinated here. And then a Sauk County resident that works in Dane or Columbia County could have been vaccinated there.
And as more data and information is available, we'll be sharing that on the Data Hub on our vaccine data page. So check back to that for updates. Okay, and the second question we've received for this week is, what are the side effects of the vaccine?
Another great question. Most common side effects are going to be very similar to other vaccinations, routine vaccinations that you might receive, including pain, redness, and soreness at the injection site. Some people will experience a low-grade fever, some chills, and that sort of thing. These side effects are really just a sign that your immune system is kicking into gear. They don't signal that the vaccine is unsafe. And to date, there are no serious long-term side effects associated with receiving the COVID-19 vaccination. But this will be closely monitored as the use of these vaccines expands. We need to remember that millions of people have already received this. The minor side effects that you might experience from the vaccine are far better than the severity of actually contracting COVID-19. The vaccines cannot give someone COVID-19.
Great, thank you for answering all those questions for us, Jessie. And next, we'll move into our data update and the 14-day trends here in Sauk County. Okay, now that we have swapped screens over to the Data Hub, and the Data Hub, if you haven't been on it in a little while, you might notice that it has changed a little bit. I have separated out into separate pages some of the data. That way there wasn't so many charts on one page and it was making it take a really long time to load. So these pages should now all load a lot faster for you. So we'll hop on down to our current information. So as of today, Thursday, February 4th, there have been 5,112 cumulative confirmed cases in Sauk County. There are currently 110 active cases, and cumulative, there have been 237 probable cases. So we'll slide on down actually and look at our new cases by day and our 7-day average. And you will see that our green line here of our 7-day average has actually dipped below our very high case burden line and into the high case burden. So that's really encouraging to see that the new cases per day have decreased significantly enough that we are now out of the very high case burden and into the high case burden. They're also on the Data Hub. If you wanted to look on this page, this is the page that gets updated Monday through Friday. We do keep that cumulative confirmed case count and also the confirmed case deaths by day, so you can see that information over time. And then also updated daily is our COVID inpatients in Sauk County hospitals and the COVID patients in the ICU. So you can see those numbers daily as well. Moving on though, we're going to take a hop over to our 14-day trends. And there have been a couple of shifts in some of the metrics. So the first shift that is really exciting for us to see is our percent positivity. So again, with this chart here, you can select Sauk from the drop-down list, and it will populate with the Sauk County data. And then if you go over here to the activity indicator section, you can change it to percent positivity, and you'll see that our percent positivity is now low, so it is actually in the green. And over the last 7 days, it really has dipped down. So the 7-day percent positivity is 3.7%. I also do calculate this out for the 14-day period so that it's consistent among the whole Data Hub. And over the last 14 days, that percent positivity is 4.6%, again, below that 5% positivity threshold that we're really looking for. So that is great to see that our percent positivity has dipped down into the green. And the last time actually that our percent positivity was in the green was at the end of September. So it has been a while since we've been able to report that this metric is in the green. Another metric that changed categories is our influenza-like illness activity in our Sauk County emergency departments. And unfortunately, that shifted from the green where it was last week's report to the red. So we are again seeing an elevated level, so an elevated percent of our emergency department visits that are for influenza-like illness. So a reminder here again, if you haven't gotten your flu shot, there's still time. It's not too late. And we're going to keep on monitoring our flu levels in Sauk County. So some other points of note in our 14-day data. Our tests conducted. Again, we do a really great job of testing in Sauk County. This is really thanks to the efforts of our community test sites and our community partners that do this. So we are consistently above our baseline of 48 tests a day. This most recent 14-day period was pretty consistent with the previous. We're conducting an average of 335 tests a day. However, While this is still in the green and we're meeting our benchmark, we are testing at way lower levels than we were back in November and even December. So seeing that decrease in testing is slightly concerning for us. It's a little bit better now that we're seeing that our percent positivity is low. But again, when we have, our testing levels, we want to see that the percent positivity is in the green, and also our community spread, which when we jump on down and look at our community spread numbers, for the most recent 14-day period, our community spread was 29%, which is an increase from last week's report. So because this community spread isn't below 20%, it is still indicating to us that we are not testing, we're not identifying all of the positive cases in our community. So there are cases out there that we don't know about, and cases that could be asymptomatic, could be unknowingly continuing to spread COVID. So a reminder here that if you have even one symptom, if you have been exposed or think you may have been exposed, please go get tested. I will also advise that we pay attention to our testing site map link and our testing site webpage, especially with our fun winter weather that we're having recently. If you check back to that, that gets updated, and we'll update that daily with any changes. If there's any closings due to weather or things like that, that information will be updated on the testing site map. So check back to it for any updates on those testing sites. The next information to share is the timeliness of our lab reporting, which continues to improve. So in the last 14 days, 89% of our positive test results were received within 2 days of that specimen being collected. So that's really good news to continue to see this metric remain in the green. That turnaround time of our tests is getting a lot better than it was. The next metric to talk about is our timeliness of disease investigation. So what this metric looks at is if we're able to interview and complete disease investigation interviews with new cases within 24 hours of that test result being received. And this metric's been staying in the yellow. So in the most recent 14-day period, 76% of new cases that were interviewed then by our public health staff within 24 hours of us getting that test result. So total 84% had an interview recorded. However, our staff are struggling to reach and to complete these interviews with new cases. So we had contact attempts recorded for 92% of those. Now, timely disease investigation and timely contact tracing is a really important tool in our toolkit to prevent further spread of COVID. So again, with it taking longer for our staff to be able to conduct these disease investigation interviews and then for contact tracing to begin, it's spreading out that amount of time when somebody who is positive or somebody who's a close contact and might not even know it isn't getting isolated, they're not getting quarantined, and there could be unknowingly spreading COVID throughout our communities. So we really encourage you to please, if you get a call from public health, if we leave you a message, to please, please, please return that call. Now, our friendly disease investigation staff are able to provide you with information, with resources, different things like that to help you during isolation and quarantine. And again, as we spoke about earlier today about our Swiss cheese defense, this getting tested, the disease investigation and contact tracing, and quarantine and isolation, these are really major tools for us right now to be able to slow the spread while we're waiting for enough vaccine for everybody to get vaccinated. So next, actually, that's a good segue to move on to our vaccination data. So there is updated once a week on the Data Hub, our vaccinations in Sauk County. So this chart shows the total number of people that have received 1 dose of vaccine and the total number of people that have received 2 doses of vaccine. And so as of February 2nd, 5,952 people had received the first dose of vaccine, and 1,293 people had received the second dose. Now, this first dose number, one of the common questions I get was, does this number of people who received the first dose include people that also received the second dose? And the answer is yes. So this is the by date who had received dose 1 of the vaccine. So if you wanted to know the number of people that had received only the first dose, you would subtract from the first dose total the second dose total. And when you do that, the total that you would get is 4,659 Sauk County residents that have received only 1 dose of vaccine as of February 2nd. So when you look that out to our population, so the number of Sauk County residents, it's about 64,000. We have about 2% of our population then that is fully vaccinated, and about 7% of our population that has received 1 dose of vaccine only and is partially vaccinated. So while I understand that our rollout is slow and frustrating, we really are making progress here to getting people in our community vaccinated. And with that, if you have any questions about the data on the Data Hub or COVID questions in general, you can email them to covid19@saukcountywi.gov. And thank you for watching our weekly updates, and stay healthy out there.